If you're over 60, your next doctor's visit might not be as harmless as you think. After interviewing hundreds of healthcare workers, I uncovered a disturbing reality that many doctors quietly see seniors differently, and not in a good way. These 5 brutal truths about medical ageism are quietly stealing your care, your respect, and in some cases, even years of your life. One retired physician called it the healthcare industry's worst-kept secret. Welcome to Journey After 60. Today, I'm exposing 5 hidden truths about aging, and more importantly, showing you how smart seniors flip the script to demand the respect and premium care they deserve. If you've ever felt dismissed, rushed, or talked down to during a medical visit, this video could literally change and even save your life. So hit that like button, subscribe with notifications on, and let's start with the very first truth that most doctors don't openly admit. Number 1. They mentally label you as expensive and complicated. The moment you walk into a medical office, your age triggers an immediate calculation in your doctor's mind. Seniors are automatically placed into the high-maintenance category. This isn't personal, it's a systematic programming built into medical training that shapes every interaction. Dr. Sarah Henderson, a former emergency physician and now senior rights advocate, explains it bluntly. Medical schools teach efficiency protocols that essentially pre-categorize patients by age groups. Seniors are assumed to require longer appointments, more tests, and complex medication management. This creates an unconscious bias before the examination even begins. Studies confirm this bias. Doctors spend about 23% less time actively listening to patients over 65 compared to younger patients with the exact same symptoms. My close friend Brenda, a 74-year-old retired librarian, experienced this firsthand. She came to her appointment with a detailed log of symptoms. Before she could even finish her first sentence, the doctor interrupted and said, "Let's focus on your main concern today." When she tried to explain that her symptoms were connected, he sighed and added, "We need to prioritize." Her chest pain was dismissed as anxiety, which delayed a cardiac diagnosis for 6 months. This so-called complexity aversion goes beyond just managing time. Many doctors shy away from ordering comprehensive tests for seniors, fearing the results will uncover multiple issues requiring extensive treatment plans. It feels easier to treat surface symptoms than to dig deeper and risk finding systemic problems. The psychological toll is significant. When healthcare providers see you as difficult and costly, they're less likely to collaborate on a personalized plan. Instead, they default to one-size-fits-all senior protocols, overlooking your unique situation. So, how do you shift this bias? Begin each appointment by clearly stating your specific, measurable health goals. Instead of saying, "I feel tired," you could say, "My energy levels have dropped about 40% over the past 3 months, and I want to understand why." That immediately reframes you from being a so-called complicated senior to a goal-oriented patient. Bring a one-page health summary that highlights improvements from previous treatments. This shows you are an active participant in your care, not just a passive recipient. Doctors tend to respond far more positively to patients they view as partners. Request appropriate time frames as well. For instance, "Doctor, I know today's visit is short. Could we schedule a 30-minute appointment next week to go over my cardiovascular concerns?" That respects their schedule while ensuring your needs are addressed. Finally, document everything during appointments. When doctors see you taking notes, they recognize your accountability, and that alone often changes how seriously they engage with you. When you show up prepared, clear, and proactive, you stop being labeled complicated. Instead, you're seen as a partner in your own healthcare. Yet being seen as expensive isn't the only challenge. Many doctors also carry another hidden assumption about older patients, and it directly affects the care you receive. Number 2, they believe older patients are less likely to follow treatment plans. A quiet but powerful belief among some physicians is that seniors won't or can't follow medical instructions as closely as younger patients. This perception comes from a mix of stereotypes, past experiences, and unconscious bias. If a doctor assumes you'll struggle with treatment adherence, they may simplify your plan in ways that aren't actually in your best interest, or avoid discussing more advanced options altogether. While the intention might be to make care easier, the result is often less thorough treatment than you truly deserve. This bias usually stems from concerns about memory, hearing, or the ability to manage multiple prescriptions. A doctor may think, "If I give too many details, they'll forget," or "If I prescribe this, it will be too complicated." While some older adults do face these challenges, it's completely wrong to assume it applies to everyone. Many people in their 70s and 80s are fully capable of following detailed instructions, tracking medication schedules, and even doing their own research to make informed health decisions. When doctors withhold information, it robs you of the chance to make choices that could significantly improve your health. For example, a specialist might skip discussing an advanced arthritis therapy because they assume you won't want the extra steps, even though you may be both willing and able to try. Or they might not fully explain how lifestyle changes could work alongside medication to better control your blood pressure. In both cases, you lose the opportunity to make the best decision for yourself. I once spoke with a woman named Carol, age 79, who had recently been diagnosed with heart disease. Her first cardiologist gave her only a very basic treatment plan, assuming she wouldn't want anything demanding. But Carol wanted to be as proactive as possible. When she switched doctors, her new physician took the time to explain every option, from medication combinations to diet adjustments and exercise routines. With this more detailed plan, Carol gained far better control over her condition. That's why it's so important to show your doctor that you're engaged and ready to play an active role in your care. Bring a notebook to appointments, request written instructions, and don't hesitate to ask questions if anything isn't clear. By proving that you can and will follow through, you break the assumption that older patients can't handle complex treatment plans. In the end, treatment adherence isn't about age. It's about willingness, support, and clear communication. When doctors see that you are committed, they are far more likely to share every option available, giving you the chance to choose the path that offers the best outcome for your health and quality of life. If you're still here and these insights are opening your eyes, drop a second below. It tells me you're not just watching, you're part of this conversation. Breaking free from the non-compliance label is crucial, but there's a bigger issue ahead. It's the tendency of healthcare providers to downplay your own life priorities. Number 3. They believe older patients are less likely to follow treatment plans. A subtle but powerful truth is that some doctors, often without realizing it, make assumptions about what really matters to older patients. They may believe that once you reach your 70s or 80s, your priorities shrink to little more than comfort and maintaining basic health. In their minds, the idea of pursuing new experiences, hobbies, or life goals fades with age. This silent assumption shapes the guidance you receive. If a doctor believes you're simply trying to get through the day, they may skip opportunities that could help you live more fully. A complaint about knee pain might only result in a prescription for painkillers instead of a conversation about physical therapy or surgery that could restore mobility. They may suggest the easiest fix, assuming you no longer have the desire to work for longer-term rewards. But the truth is, many older adults still carry vibrant, meaningful goals for their future. Those goals matter deeply, even if they require energy, planning, and effort. Ignoring them is ignoring a vital part of who you are. I carry this truth in my own story. For years, I lived with chronic lung disease, and my first doctor advised me to stay home and focus on comfort. But I wanted more than comfort. I dreamed of visiting my sister overseas. When I finally shared this dream with another doctor, the response was completely different. He created a program tailored to my goal. A gradual exercise plan to build stamina, adjustments to my medication, and practical steps to prepare me for the trip. 6 months later, I boarded that plane and reunited with my sister. It was one of the most joyful and meaningful experiences of my life. That experience taught me something powerful. Your aspirations don't lose value with age. Whether it's gardening, joining a local club, writing a book, or traveling to see loved ones, your healthcare should be shaped to support those ambitions. If your doctor doesn't ask about your personal goals beyond basic survival, speak up. Share what matters most to you, and ask directly how your care can be aligned with those outcomes. Because at the end of the day, it's not only about living longer, it's about living better. Your goals matter at every stage of life. Don't be afraid to voice them. With the right support, you can not only extend your years, but fill them with purpose and joy. And here's where things can turn even more frustrating. Even when your dreams are acknowledged, too often your very real symptoms are brushed aside as if they're simply a natural part of getting older. Number 4. They often assume most symptoms are simply due to aging. Doctors sometimes use what you might call polite medical dismissal, writing off your symptoms as normal aging. It has become so common that many healthcare professionals don't even realize they're doing it. But this subtle form of ageism delays proper diagnosis and treatment. Dr. Michael Torres, a geriatrician who has spent his career fighting age bias in medicine, explains, "The phrase, 'you're just getting older,' has become a medical excuse. It's used to dismiss symptoms that would trigger immediate investigation in a younger patient. That isn't evidence-based medicine. It's an assumption based on age. The statistics are alarming. Research from the American Geriatric Society shows that 85% of serious conditions in older adults are initially attributed to aging before the correct diagnosis is made. The pattern is predictable. Doctors use phrases like, "That's normal at your age," or "We all slow down," to redirect the conversation away from real investigation. They suggest generic solutions: more exercise, better sleep, less stress, without asking why the symptoms appeared so suddenly. Women face a double bias, with symptoms dismissed as both aging and hormonal changes. Men often have concerns about sexual health or emotional shifts brushed off as normal male aging. Mental health is especially at risk, with depression and anxiety written off as life transitions instead of being evaluated as medical conditions. The most damaging part is psychological. When authority figures repeatedly tell you your symptoms are just normal, you start to doubt yourself. That self-doubt delays seeking help and tragically worsens outcomes. So how do you fight back? Always respond to age-based dismissals with specific, pointed questions. If a doctor says, "That's normal at your age," ask, "What percentage of people my age experience this exact symptom? What research supports that this level is considered typical?" Most can't provide evidence because they're relying on assumption, not medicine. Create a clear symptom timeline to show sudden changes rather than gradual decline. Instead of saying, "I've been more tired lately," present the data. "My energy was steady until March 15th when I began needing naps for the first time in my life." That reframes your concern from just aging to an acute onset symptom. Request specific diagnostic criteria. Ask, "What tests would you order if I were 40 with these same symptoms?" This forces the doctor to justify different standards based solely on age. Often, they'll recognize their own bias and order proper investigations. Use what I call escalation language. For example, "Doctor, I understand aging affects energy levels, but this is a significant change from my normal baseline. I'm worried it could indicate an underlying condition. What steps can we take to rule out medical causes before attributing it to aging?" And don't go alone if you can avoid it. Bring an advocate to your appointments. When another person witnesses dismissive behavior, doctors often adjust. An advocate can also ask questions you might miss and help document the conversation. Do you see the pattern here? If you've ever experienced this kind of dismissal, let me know in the comments below. And don't forget to save this video so you'll have these strategies ready the next time you face a medical appointment. Number 5. They may underestimate the impact of emotions on senior health. Still, there's one last hidden truth we need to confront, and it might be the most important of all. It's the tendency to downplay the impact of emotions on senior health. While many doctors focus almost entirely on physical symptoms, too often they overlook how emotional well-being shapes overall health, especially in older adults. Aging isn't just about joints, blood pressure, and lab results. It's also about adapting to loss, changes in identity, and sometimes living with reduced independence. When the emotional side of health is dismissed, treatment plans become incomplete, leaving essential needs unmet. Too often, sadness, anxiety, or withdrawal are waved off as just getting old, instead of being treated as issues that can and should be addressed. Doctors may not ask about loneliness, grief, or fears about the future, simply because those questions aren't on a standard checklist. Yet these emotional factors directly influence physical health. They affect sleep, appetite, immune function, and even the body's ability to recover from illness. I think of Margaret, a 76-year-old woman who lost her husband after more than 5 decades together. In the months that followed, her health declined sharply. She lost weight, felt constantly fatigued, and struggled with high blood pressure. But every appointment focused only on adjusting her medications. No one asked her how she was coping with her grief or whether she had support at home. It wasn't until her daughter encouraged her to join a support group for widows that things began to change. Talking openly about her pain helped Margaret feel less alone, and over time her physical health improved, not because her prescriptions changed, but because her emotional burden was finally acknowledged. The challenge is that emotional struggles in older adults are harder to detect, especially if you don't voice them. A doctor might assume you're fine just because you say, "I'm okay," when asked. That's why it's so important to speak up, even if it feels unrelated to your medical condition. Telling your doctor about sadness, stress, or loneliness isn't complaining. It's giving them the full picture they need to truly help you. When the emotional side of aging is ignored, patients can feel unseen and unsupported, and that quiet burden undermines physical recovery. But when it's acknowledged and addressed, it can lead to better health outcomes, renewed energy, and a stronger sense of purpose. A good doctor will understand that treating you as a whole person means caring for both your body and your mind. And sometimes a single, honest conversation about how you feel can be as healing as any prescription. So, there you have it. 5 ugly truths about what doctors really think of older patients. They may label you as complicated, assume you won't follow treatment, dismiss your life goals, blame your symptoms on aging, or underestimate the power of your emotions. Each of these biases quietly chips away at the care, respect, and dignity you deserve. But here's the empowering part. Now that you know these hidden truths, you can recognize them, challenge them, and rise above them. You have the right to ask questions, to demand answers, and to be treated as a whole person, not just a number, not just an age group. And remember that age is not the enemy, silence is. The moment you speak up for yourself, you reclaim the dignity no one can take away from you. Your voice matters, your goals matter, and your health, both physical and emotional, matters at every stage of life. Never let anyone tell you otherwise. If this video opened your eyes, hit that like button and share it with someone who needs to hear these truths. And don't forget to subscribe with notifications on, because I'll keep bringing you the knowledge and strategies that help you live not just longer, but stronger, wiser, and more fulfilled. I truly hope you will drop in comment which of these 5 truths you've experienced most in your own healthcare. I read every single one, and your story might give another senior the courage to speak up. Thanks so much for watching Journey After 60. Remember, you don't just deserve care, you deserve respect. I'll see you in the next video.